Okay, let's get right to it. You've got an exam coming up, and you need to figure out how to systematically build a rock-solid 25-mark answer on the screening models for antipsychotic drugs. Well, you're in exactly the right place. Today, we're doing a masterclass on Chapter 88 of our Pharmacology source text. I'm going to walk you through this explainer like you're starting totally fresh with these specific models, so we can systematically break down every behavioral test and assay you need to know. By the time we're done, we won't just have these procedures memorized, we're going to truly understand the pharmacology behind them. So grab your notes and let's dive in together.
Here is our roadmap for the session. We'll start with screening fundamentals, move into behavioral models, spending some good time on Cook's pole climbing test and catalepsy, then tackle mechanism of action tests, and wrap it all up with in vitro and ex vivo assays.
Section 1. Antipsychotic Screening Fundamentals. Before we even test a drug, we have to ask ourselves what actually makes a good test. Because schizophrenia in humans involve such complex positive, negative, and cognitive symptoms, our screening models have to be incredibly rigorous. To secure top marks, you'll want to outline these 5 characteristics of a valid behavioral model. First, the behavior has to be genuinely relevant to the clinical condition. Second, the paradigm should ideally be translational, meaning it works in both rats and humans. Third, it absolutely must be selective and specific to antipsychotic drugs, both in vitro and in vivo. Fourth, a truly robust model can actually tell the difference between the older, typical antipsychotics and the newer, atypical ones. And finally, the best models? They don't require you to give the animal any other drugs beforehand just to see the baseline behavior. Nailing these 5 points is the absolute perfect way to introduce this topic in your exam.
Section 2. Behavioral Animal Models and the Smart Pace Framework.
Okay, here's the secret weapon for your 25-mark answer, the Smart Pace Framework. It's an incredible mnemonic tool for structuring your notes. S is for screening type, M is model, A is aim, R is requirements, T is technique, P is parameters observed, A is advantages, C is constraints, and E is evaluation. Let's apply this right now to a classic exam favorite, Cook's pole climbing test. Imagine this setup. You have a dimly lit, soundproof chamber. Notice the metal grid floor at the bottom? That's the shock zone. But right there in the very center is a wooden pole, which acts as the rat's safe haven.
Let's rapidly walk through the first half of our framework, the SMART components for this test. Screening type, it's an in vivo test. Model used, rats. Our aim here is to evaluate the conditioned avoidance response, or CAR. And for requirements, you'll need the chamber itself, a 1.5 milliamp shock grid, a wooden pole that is 2.5 centimeters in diameter, a 2.8 kilohertz speaker to play a bell tone, and a 28-volt light. See how neatly that organizes the facts?
Now, before we look at the technique, we have to make sure we totally understand the aim. What exactly is the conditioned avoidance response? Well, CAR is simply an active response made by the subject to a neutral, conditioned stimulus, like hearing a bell, specifically in order to avoid an aversive, unconditioned stimulus, which in this case is the electric shock. Basically, the rat learns, hey, the bell predicts a shock, and it takes action to avoid getting shocked entirely.
So what is the technique here? Step 1. You place the rat in the apparatus and present that conditioned stimulus, the bell or the light, for exactly 20 seconds. Step 2. Immediately after that, you deliver the unconditioned stimulus. That's the 1.5 milliamp scrambled electric shock through the floor grid. Step 3. You repeat this. The actual test session consists of 25 of these trials spaced out over 60 minutes. Pretty soon, the rat figures it out. It learns to actively avoid the foot shock altogether by scurrying up that wooden pole the second it hears the bell, but before the shock is actually delivered. When it does that, we have a successful conditioned avoidance response.
Now, what's really fascinating about this slide is the E in our framework, evaluation. This is the absolute goldmine for your exam. How does this test prove a drug is an antipsychotic? It's a brilliant pharmacological distinction. If you give a rat a neuroleptic, an antipsychotic drug, it selectively suppresses the avoidance behavior. The rat hears the bell but just kind of sits there. It doesn't climb the pole. But when the shock actually hits, it will still climb the pole to escape. It can move, it just stopped anticipating. Now, compare that to a typical sedative like a barbiturate. A sedative just suppresses the whole shebang. A sedated rat won't avoid the shock when the bell rings, and it won't even try to escape when the shock hits. That specific ability to suppress CAR without stopping the escape reflex is highly correlated with clinical antipsychotic potency. Let's move to our next major behavioral deep dive. Catalepsy,
also known as catatonia. Catalepsy is defined as the failure to correct an unusual, externally imposed posture for a prolonged period of time. It's essentially physical rigidity caused by a direct blockade of dopamine in the nigrostriatal pathway. Older, typical neuroleptics like haloperidol are famous for reliably inducing this rigid, almost statue-like state.
Running this through our SMART framework makes it a breeze to remember. Screening type, in vivo. Model, rodents, usually rats or mice. Aim, to measure nigrostriatal dopamine blockade, which tells us about the drug's extrapyramidal side effect profile. Requirements, your test drug, and translucent plastic boxes equipped with a horizontal wooden dowel mounted exactly 10 centimeters from the floor and 4 centimeters from one end of the box.
For the technique and parameters observed, the procedure is incredibly precise. First, you allow the animal to adapt to the box for 2 minutes. Next, you gently grasp it around the shoulders and carefully place its forepaws right onto that wooden dowel. You're going to conduct 3 trials per animal at very specific time intervals after dosing: 30, 60, 120, and 360 minutes. The vital parameter observed here is time. You start your stopwatch the exact moment you place those paws. The key cutoff threshold you absolutely need to remember is 60 seconds. If the animal remains frozen on that bar as the clock hits 60 seconds or more, it is officially considered catatonic.
To ensure your exam answer is fully comprehensive, you'll definitely want to list a few other fascinating behavioral models. Mention the golden hamster test, which looks at how these drugs suppress innate aggressive behavior without impairing motor function. Then there's the cotton rat test for assessing flight reflex suppression. There's even an incredible artificial hibernation model, where rats are placed in a sealed glass vessel in ice water. Neuroleptics actually augment this state of cooling and hypoxia. Finally, you can toss in foot shock-induced aggression in mice and brain self-stimulation. Rattling off these names really rounds out your behavioral knowledge for the examiner.
Section 3. Tests based on mechanism of action.
We're shifting gears now. We're moving from observing pure behavior, like climbing, to targeting specific pharmacological pathways. These mechanism-based models generally rely on stimulating the dopaminergic system with an agonist, and then watching how our test antipsychotic antagonizes or blocks those effects. For example, we look at the inhibition of amphetamine stereotypy, where amphetamine causes continuous sniffing and chewing, but neuroleptics prevent it. There's also the inhibition of apomorphine-induced climbing. Some other really intriguing models include the yawning and pineal erection syndrome in rats, the inhibition of mouse jumping caused by amphetamine, the inhibition of apomorphine-induced emesis in dogs, and the purposeless chewing model in rats.
So, the crucial point here is understanding why we use specific drugs like apomorphine. If you give a rat 1.5 milligrams per kilogram of apomorphine, it triggers a highly characteristic stereotyped behavior: repetitive, compulsive licking, sniffing, and gnawing. When a test compound successfully antagonizes dopamine receptors in the nigrostriatum and blocks this gnawing behavior, it gives researchers highly predictive insight into that drug's ability to prevent tardive dyskinesias in humans. It's a really powerful direct pharmacological correlation.
Section 4. In vitro and ex vivo assays.
For our final categorical chunk, we're zooming way in to look at rapid-fire biochemical assays. While behavioral tests show us the whole organism's response, these in vitro methods give us the microscopic picture at the receptor level. Researchers rely heavily on radioligand binding assays here. For dopamine, we test affinity for D1, D3, and D4 receptors. But you definitely want to specify D2 receptor assays using tritidated spiroperidol binding as well as D2 autoradiography. Because newer atypical antipsychotics act heavily on serotonin, testing 5-HT2 receptor binding using tritidated spiroprone is also essential. Beyond just binding, we can actually measure the physical levels of neurotransmitters like dopamine, norepinephrine, and serotonin, and their metabolites simultaneously. And for advanced techniques, you can mention intracranial microdialysis, which lets us measure neurotransmitter fluctuations in the extracellular fluid of a living brain in real time.
Okay, we've covered the fundamentals, the behavioral models, the mechanisms, and the in vitro assays. To wrap up this explainer, I want to leave you with a provocative question to really lock in your attention. Based on the evaluation phase of our SMART PACE framework, what is the single most vital behavioral parameter that distinguishes a true neuroleptic from a simple sedative in Cook's poll test? Think back to that critical difference between the avoidance response and the escape response. If you can clearly articulate that difference and use the SMART PACE structure to organize your thoughts, you are absolutely prepared to secure all 25 marks on this exam topic. Keep organizing your notes, keep that curiosity alive, and I'll catch you in the next explainer.